Time for us to look at your health, and I want to hand over to my co-host Trix Ingado to take over that segment. Trix.
Thank you very much, Michael. And of course, today we are focusing on the shortage in blood in the country. It's not no secret that this is a very important thing for many people, be it accident victims, people living with conditions such as sickle cell anemia and what have you. And so to just bring us into that conversation, again, take a look at a story that's going to just help us put the foundation for this discussion. Now, Kenya is staring at a blood transfusion crisis. The Kenya National Blood Transfusion Service is yet to procure blood screening reagents after the President's emergency plan for aid relief funding came to an end. The country needs at least 14 billion shillings to process blood for transfusion, but the Kenya National Transfusion Service has been allocated less than a billion shillings. Dr. Mercy Korir reports on the blood screening challenges facing the country.
On social media, such messages paint a picture of the situation in hospitals across the country. A shortage of blood supplies. The Ministry of Health says that Kenya needs 1 million units of blood per year. Last year, the center collected 164 units of blood, not even a quarter of the target. And it appears the situation is bound to get worse. The President's Emergency Plan for AIDS Relief, PEPFAR, a U.S. government initiative, has been providing funding for blood safety programs, including infrastructure like buildings, vehicles and equipment, policy and guidelines, training, blood collection, blood testing, as well as processing and blood establishment computer software. Between 2004 and 2018, PEPFAR spent 7.25 billion shillings on blood safety. Last year alone, it was 200 million shillings, but the funding has since come to an end, seemingly getting the Kenya National Blood Transfusion Services off guard, since adequate reagents for screening blood are yet to be procured. Currently, 2 types of equipment are used for screening. The Chemi, which runs up to 700 units per day, or ELISA, which can run at least 180 samples a day. It costs the government 14,000 shillings to process 1 unit and ensure safe blood reaches patients. With the country's annual blood needs standing at 1 million units, Kenya needs at least 14 billion shillings to process blood from collection to actual transfusion.
For us to make sure blood is safe for use, it must go through processes, and these processes require money. It requires money to buy a blood bag. It requires money to screen that blood, and not just screening using simple methodologies. Sometimes we are forced to use slightly more sophisticated methodologies.
A worrying trend is already developing if the figures from blood transfusion centers in 12 counties are anything to go by. On the 12th and 13th of this month, of 623 units of blood in Kiambu, none had been screened. In Kericho, out of 305 units, only 29 were screened. In Eldoret, 35 of 288 units were screened. In Kisii, none of the 212 units were screened. Machakos too, none had been screened out of 170 units. Only Migori passed the halfway mark with more than 80 units of blood screened.
A lot of times people think blood is just for free. It's freely given. That is true. And we encourage people to continue giving freely because it is impossible to pay for blood. Blood is a tissue.
It turns out the challenge is not just about funds. The Kenya National Blood Transfusion Service is facing an acute shortage of staff, from drivers, clerks, nurses to laboratory technologists. The National Blood Transfusion Service requires 448 members of staff, but the department has only 117, 2/3 less. With blood donations not reaching the annual recommended units and insufficient funds to guarantee blood from donor vein to recipient vein, the lives of those in need of blood for a number of indications, including surgery, cancer treatment, or expectant mothers, may be in jeopardy. Dr. Masikorir, KTN News, in Nairobi.
Right, thank you very much, Dr. Masikorir, for that story. That just sets the pace for our conversation. And joining me to just paint a clearer picture on this particular problem is Eunice Owino, who sits on the board for the Sickle Cell Federation of Kenya. We do know that people living with sickle cell anemia cannot live or survive without frequent blood donations, and of course blood transfusion is of course what goes to help them actually live. It saves their lives, it reduces the risk of complications such as crisis and what have you. So thank you so much for joining us, Eunice. When you see that story, I'm sure it's closer to you. Could you explain to us why it actually speaks to your experience as a person?
When I see this shortage in blood, it means that my sickle cell community, because I call them my sickle cell community, people, because like yesterday I had to look for blood.
Yes.
There's a patient, we call them warriors nowadays. There's a warrior who called me and said, I need blood, I'm admitted. And when you call to the blood bank, they'll tell you we don't have blood. So you have to mobilize people to go donate blood for her. And then when they reach there, you'll find out that there is no even enough, because people can't be donating for you blood every day.
Yes.
Because with the way blood donations goes is, for women, we donate after 4 months. For men, they donate after 3 months. So you can't rely on a certain group of people. So that's why there are different people trying to organize.
But then we are 47 million in this country.
Yes.
So if 1% would give blood, we'd have at least almost 500,000. So is it that people
I can't say that like that.
Yeah.
Reason being,
is it that people are, my question would be, is it that people are unwilling, or is there a problem further down along the line from just the donations?
what we are forgetting is right now the lifestyle people are living, everybody has a challenge.
Okay.
So not everybody is willing to donate. The best ages to donate blood is especially in high school, between 16 and 18, and actually 24. That is the best time to donate blood, because I can say their blood is pure.
Yeah, so that cuts out a significant portion of that, of 7 million that we're talking about, those millions we're talking about, the 47 million. And then, of course, other complications, because we need screening.
Yes.
And we heard from Mercy's story that there's blood that is not being screened.
Yes.
I mean, is this blood being used, or is just going to waste? What's the challenge
Definitely,
there?
if it is not screened, blood expires after 35 days.
Yes.
So after 35 days and you've not screened the blood, that means then the blood has spoiled.
Yes.
And you can't use it.
Yeah, so while we might be having these campaigns, people being called out to come out and donate blood, we're having a situation where it's going nowhere. What does that mean for your community?
For my community, that means it's a death sentence.
Wow.
Reason being, when I have a crisis, the way you just said, it means my sickling cells are become very anemic.
Yes.
And my blood level will go very low, even to a level of 2. That means I need to be added 7 pints of blood. And if I don't get that 7, that means I'm at a high risk.
And a pint is the one that they take out of one person.
Of one
So
person.
for one person to survive, you need a donation from 7 other people.
Yes.
And this blood should have been screened to ensure that it is safe, and ideally from a young person, maybe in schools. And we used to have the Red Cross and other organizations coming to schools, educating kids, and then encouraging them to donate.
Yeah.
Is this still happening?
Yes, it does, because I also do blood drives in collaboration with BloodLink and the National Blood Transfusion Services of Kenya, because they're the overall authority that is allowed to do blood donations.
Right.
Yeah, and now people are doing more blood donations in hospitals than the way it used to be. Yeah.
And so when organizations such as the Red Cross, do they not have the capacity to ensure that blood is done, the screening and all that is done, and provide the reagents? Because these are organizations that are funded. While we're talking about a lack of funding, they are funded. So do they lack capacity, or how, in your opinion, do we drop the ball? Where do we lose it?
Can I say, like, in the blood world, it's only the Kenya National Blood Transfusion Services that are allowed to do the screening.
Yes.
The rest of the organizations are there to help them to do blood sensitization and also blood and campaigns and also blood drives.
Right.
Yeah.
So as much as they would go out and collect all the blood, it would draw down to the organization that we're talking about to actually ensure that there's screening, and now this blood is distributed to the people who need it. Now, let's get back to people who actually need this blood. So paint us a picture of someone who is going through a crisis. You said you would call the blood bank and you'd call the hospitals and they don't have blood. What then happens? Are there options, or?
The only options we use nowadays is social media. So with social media, there are groups like Wanadamu. There's another group that came up the other day. So what they do, they send people to you to come donate for you.
Yes.
As much as you don't know them, you don't have to pay them.
But does it directly go to you?
Sometimes it depends with the blood group also.
Okay.
Then also some hospitals will play a game on you. They'll say, you still need to add more people to bring in the blood. Because nowadays also what is happening is the hospital themselves, they're the ones who are doing the blood donations and also screening. Yeah.
But so when you did do this local arrangement, I'm concerned about the issue of safety.
That's why I'm saying the hospital itself is the one that
do the screening. So
screening.
After you find your people, and then they do the screening, and then they sometimes convince you to get more people, but this is just for their own their own reserves.
Depending.
Have you had such an experience personally?
Yes, we have.
And then what do you do?
There's nothing you can do. As much as maybe the doctor decided that you need maybe 2 or 3 pints. So you call 4 people.
Yeah.
Out of 4, sometimes it happens, you'll find maybe one has a pressure, or maybe you'll get all the 4, but they are not your blood group.
So that is there a sort of exchange program that they can do? So as long as you bring the people, then they can swap with the right blood transfusion. Perhaps explain to me now what your board does or is doing to ensure that we try and solve this problem at your capacity.
Our board right now, what we're doing is just continue sensitizing people on blood donations and blood drives. And just because without blood, we can't really survive. That's why we need blood every single day.
Right.
Because every single day there's a newborn baby. There's that mother who is in hospital, and during pregnancy or during the birth delivery, it means that they'll need to be donated blood if they lose a lot of blood.
Yes.
There's the accident victims. There's the cancer patients. There's also the hemophilia patients who also just need blood to be always added to their body. It's not only for sickle cell patients, but for sickle cell, because of the sickling cells, sometimes you end up even you need to be removed that sickling cell, and then they add you new
fresh blood. Yes, absolutely. And this is not obviously turning into some sort of red gold, because now it's not available. And we are being told there was an oversight. Perhaps could you furnish us in terms of after the donations, the donors pulled out, we do not have a sustainable program. Do you have the knowledge of how this has affected the community? Because we were depending on people outside this country, but then after a while we were told this won't happen. We were given at least 2 years to figure this out. We obviously haven't. Give us your sentiments on that.
My sentiments are because actually how even the Kenya National Blood Transfusion Services started was during the '98 bomb blast. So the U.S. government...
Even before that, we didn't have a plan.
We didn't have a plan. So the U.S. government, so there's need for people to always have blood in the blood banks. So they supported the program for
Based
10 years.
on what happened,
Yes,
yes.
for 10 years. So actually, is it 10 or 20? Almost 20 years.
Yeah, it's been, yeah.
I
That was
don't-
1997.
It was 1998.
Yeah. 98, yes.
It's when now the National Blood Transfusion was formed. Then I think between around 2010, 2012,
Yeah.
2013 there is when now they pulled out.
Okay.
So from there, they've been having, because I've been privileged to sit in their board as we always celebrate the World Blood Donor Day on June 14th. So during just planning is when now you come to realize that the donors have really pulled out.
Yes.
So even just to celebrate that World Blood Donor Day becomes an issue.
Yeah.
And since it's a government, it was handed to the Kenya government.
Yes.
So it all goes back to our Kenya government. What are they doing?
Yeah.
Especially the Ministry of Health. They are the ones who need to come up with policies. How are we sustaining?
Right.
These people have supported you throughout. So it seems like they didn't have a fallback to lift them up when now the donors pulled out.
Okay.
And that's why, according to the report, you could even see that even the staff themselves,
Yeah.
they're understaffed.
Absolutely.
Yeah.
And now when you talk about access to healthcare, those are one of the pillars of the agenda for of the government. And I feel like this should be a priority because we have devolved health services to enable them to reach to the common wananchi, right? Even in Mashinani, everyone should be able to access a hospital that will service them with whatever health needs they have. Where along that pipeline, where does access to blood fall, and has this actually helped with devolved functions of health? Or has it made it even worse to access,
To
blood
access
donations? Yeah.
blood donations.
Let's say you're somewhere remote in the north or somehow. So how do you go
Actually,
about
when
it?
the devolution came
Yeah.
about, when they were forming the blood, everything, the satellites plus the blood centers itself,
Yes.
it was now done regionally. If you
Yes.
remember, we were in 8 provinces. So you could find like in Nyanza, there's Kisumu and Kisii. They're the ones who have like a real blood center. Now, if you go to a place like Bungoma or Bungoma, Siaya, they're satellites.
Okay.
It's just a small room where they themselves, they don't keep blood, but it acts like a satellite where it's like a point where if you need blood, you go to them.
Yeah.
So they're the ones who will organize with the main centers where you can get the blood.
Okay.
Yeah.
And so when you're hearing stories of I went to Bungoma and I was told there's no blood and I need to go all the way to Eldoret, are they still a reality right now? Yes. Yeah.
Is it really a reality? Not really. But at the end of the day, is because also the capacity of screening of the blood.
Yes.
And then also how long will that blood take from Eldoret to Bungoma to where you are?
Yes.
So those are the loopholes that...
because and that brings in a very important question. You're talking about blood donations. What we see when you're giving blood is just you seated there with the tubing and the little sachet.
Yeah.
But there's so many other elements to preserving blood. Could you explain to us so that we can better understand the things that go into and the facilities that are needed? Because we're talking about reagents. We're talking about this. Even the sachets themselves, they cost money, which obviously we don't have. Explain to us all that to the point that it gets to
the common one.
Yeah.
So first of all, just mobilizing people to come and donate blood. That's an exercise on its own. There's the paper you fill. To an extent, right now, the Kenya Blood Transfusion are not even able
We
to...
don't have papers to write
yes, the
our
questionnaires.
details. Oh, wow.
Yes.
Okay.
So I had a story, I don't know how true that is,
Yeah.
that people were told to go and photocopy it themselves. Yes.
So I want to give you blood. I come to get the form, and then I'm told go and photocopy this yourself with your own money.
Yeah.
So
now, this is not even in the hospitals. This is just maybe when they're doing a blood drive.
a blood drive, yeah. So after I go look for a photocopy shop or
Then
whatever,
you come,
then I come back.
Because even the bags right now, the way you saw in the report,
Yes,
the bags are are fewer.
Okay, so
And the bags are already, there's a kind of treatment that it goes through.
yes, it's not your usual plastic bags. Yes. So let's just go step by step. So you've gone and photocopied your form and you brought it back. So you've overcome that hurdle, and then obviously you need to give the
now
blood.
They'll check your your information.
This requires personnel.
Yes.
Yes.
So there are questionnaires that also just answering by the questionnaire. It will guide the person who is bleeding you to know if you're a suitable candidate or not.
Yes. And then there's the physical test. They check your weight.
Yes.
Yeah. Take us through that.
So they'll check your weight and then also just take a bit of your blood just to check if you have enough blood for yourself or you can share. So with that, I've forgotten the name of that test. So they put it in, I call it in a blue
A solution,
a solution.
Yeah.
So when it goes up, it means you have very kidogo blood you can't give.
Yeah.
When it goes down, it means you can donate.
Yeah, okay.
So from there, they'll ask you, definitely the questionnaire has if you have a tattoo, if you're on if you're taking any medication.
Right.
Or if you're a woman, if you're in your menses, then definitely you can donate. Or if you're breastfeeding, definitely you can donate. So after that, then you're good to go.
Yeah.
They'll ask you if you have pressure, history of all that. Then you'll be put in the chair and you start bleeding.
Yes.
Which definitely you just take between 250 to 350 ml of blood that goes into the bank.
Right.
Into
and
that
then
bank.
after that, obviously, for the people who have given blood, they're given snacks or whatever.
You're given a soda. It's not really to bribe you.
It's not a reward. It's
just
bring
to help you.
Yeah.
Because you've removed a bit of liquid from your body, which is blood. So your body might misbehave. That's why sometimes
faint
others faint because of the body now trying to adjust.
Yeah, so obviously that requires money because you have to stock the sodas.
The sodas and water.
And water and anything else that is given to the people. And then after that, now we have these bags that have been collected. They're supposed to be preserved. Tell us about the sensitivity of that process.
So that time it goes back to the National Blood Transfusion Services in their labs. So in their labs is where now they do all the
Is there a
screening.
special care that needs to be taken?
Yes,
given
there's
to
a
those
way you're supposed to
bags?
handle blood.
Right.
And that's why even if you're transporting from maybe the bank to the hospital, it has to be in a cooler box.
Okay.
Yeah. So there's a certain temperature the blood needs to be.
Yes.
So through that, what is called their lab, is when they'll do all the screenings.
Right.
From hepatitis, HIV, and any form of blood.
Okay.
And then at least they have improved nowadays. They can give you a whole pack or just the whole blood.
All right.
So they remove some components in the blood. And then what you need is what you'll be given.
Yeah. So
it's still a process that goes on and on.
Yeah, so you transport them to the center and then they do all that. So when they find that there's blood that is impure, probably a significant amount of that blood is not usable.
Yeah.
So that basically pulls down the numbers from what you had, obviously from the ground or the drive to what you can actually use. So moving forward, as we think of the position that the country is in, what do you foresee happening in the near future? Have you seen plans, or do you feel like the government is doing all it can, or those in these authorities that are meant to handle this, are they doing all they can to meet the needs of sickle cell warriors, people living with anemia, people who have been in accidents and need urgent help as far as blood transfusion is concerned?
No.
Why not?
Reason being, the government needs to put policies in place.
What will these policies do, and how different would they be from what we have right now?
For now, our prayer and hope goes to the new CS of health. So once he's in office, our plan is to go have a serious talk with him,
Right.
so that we can put things in place. If the blood services can't run as a part of government, maybe they can decide and put it as part of it can be taken up with other organizations,
Right.
like BloodLink or any other organization who is into blood, and they're already having funds,
Yes.
because they have already donors who are willing, the way you said, Red Cross, BloodLink. These are entities who have been supporting the Kenya National Blood Transfusion.
For sure.
So if government can't handle that, then they can give them back to such organizations
Or partner with
or
them.
partner with them,
Yeah.
so that we can reach that place. Because if you go to a country like Rwanda,
Yes.
you'll find they have a plan for the whole year.
Okay.
Their blood bank is full for the whole year, so you can't miss blood. And those are the things we need to put in place. It's just a simple policy document.
Right.
Like, what do we need? We have school kids. Let's hit it now before, because when you start, I always call it the new Form 1s, especially now when they reach 16, when they go to Form 2.
Yes.
That is the time now they are able to start donating blood.
Yeah.
And also the new university students
yeah.
who are joining.
The early 20s.
The
and
early
late
20s,
teens,
yes.
yeah.
So you capture that, and that's how we can start sustaining the blood
The
bank.
blood bank, yeah.
Yeah.
And so as you try to draw us a picture, someone living with sickle cell anemia, how many pints of blood would you on average say they would need, or transfusions they would need, let's say per year or per month?
Depending on
Yes.
the person. They'll need between, an individual might need between 8 to 10 or
8
even
to
12.
10? Yeah, so let's say 1 per month, right? And
Yeah.
how many would you
Not
say?
even 1 per
Yeah,
month.
Yeah.
In 1 month, if they are having very bad crashes, they might even end up having 5.
5.
Yeah.
Yeah, so it varies.
It
and then
varies.
looking at the number of people living in with sickle cell anemia in the country, how many would you estimate there are?
That is what
Yeah.
we are still fighting.
Yeah, because
to get the
documentation,
number.
yes.
We don't
But
have.
on average, if you could give a guess, does it go into 10,000s or? Because
I
I'm
think
trying,
we are 1 million plus.
1 million plus.
It's just that people are ignorant of sickle
Yes,
cell,
yeah.
and people don't talk about sickle cell, because the last research that was done on sickle cell was in 1982.
Wow, that's
Because
that's
I remember
despicable.
in 2014 when we went to the Ministry of Health and we told them we exist and we are
We
here.
need to be, because if we have data,
Yeah.
then we can plan for us. If we don't, then
and
we cannot
they
make
went
plans.
like, you mean you people exist? We
Wow.
were like, we were not supposed to die, because what happened is we used to lose a lot of children, a lot of
They didn't make it
patients.
into adulthood.
Yes.
Yeah, so it was assumed that they are not even a part of the population that needs
True.
to be, counted and planned for.
Yeah,
which
right
is,
now we
which is
have
pretty
the
unfortunate.
oldest person living with sickle cell in Kenya is 62.
Imagine that.
In
yeah.
Nigeria, they turned 94 last year.
Wow.
And we still continue growing.
So there's progress. So
Yeah.
the reason I was asking you for the numbers is because I would imagine if there's millions of people living with that and they need over 10 pints of blood every year, let's say 20, you can imagine the millions that we need just for that specific community. Forget about the other
And
people
then,
who,
yeah.
the emergencies and people living with other conditions. So it paints a picture of a dire need that is obviously not being met. So what would you, as we conclude the conversation, what would be your appeal to the government and all those stakeholders as far as this matter is concerned?
I think we need to have a meeting as stakeholders, and then also we need to make sure that our blood bank is really full, because people are suffering out here.
Okay.
Yeah.
Absolutely. Thank you very much. That has been Eunice Owino, who sits on the board of the Sickle Cell Federation of Kenya, just trying to paint us a picture of the need for blood in the country and where we have gone wrong in ensuring that people are living decent lives. I'd like to invite Michael as we conclude this conversation and the show in general.
Yes, thank you very much. That, I think, was very informative. And, of course, giving blood is one of those things that we need to encourage people to do, so long as the agencies are there. But one of the concerns, I think, that I was looking at our social media that was coming up is, of course, the safety of it.
Right,
Because given the transfer of, diseases and things like that, I don't know how we are doing, how well we are doing as a country in terms of how safe we are when it comes to blood, donations.
Yeah.
We are very safe.
We are.
We are very
So
safe
people
because
can
it
confident.
has, yes, it has to go through a lot of screening
Yes.
before you're given that blood as a beneficiary.
Yeah.
What about the point of actually donating that blood? You know, the needles that are used, the practitioners that do that, are they well trained? Can I be confident that when I'm doing that, I am not getting transfer of diseases?
Yes, they are very well trained, and it's very safe.
Okay.
It's
All
very
right.
safe.
We shall take your word.
Would be with the fact that you can all donate and then that blood goes bad because they are not equipped to screen or you know,
But if you
they
want
don't
to,
have
after the
reagents.
screen,
Yeah.
and you want to know your results, if you have HIV or hepatitis,
Yeah,
they can
actually.
do that on one-on-one
Basis
but not
for you.
in public.
Not in
They
public.
don't do that.
Yeah.
All right, thank you very much. That, I think, was a great conversation, but it brings us to the end of the show right here on KTN News. This is Morning Express. My name is Michael Gitonga. Thank you for watching. God bless.
And I'm Trixie Ngado. Have yourself a lovely day.